Okay guys, welcome back to another training video in the 200 level clinical team training series. In this video, we will be reviewing how to increase the office's production through same-day treatment. Same-day treatment is better for everyone, both the patient and the office. The patient obtains treatment faster, and this is valuable especially in today's fast-paced society where everyone wants everything yesterday. Quite often these patients are also in pain. Faster resolution of pain is always a better thing for the patient. The office production for the day will increase. This is especially important if you have not met your scheduled production goal discussed in your morning huddle. Frequently, these types of same-day treatment are lower production valued procedures, like extractions without implants, crown lengthening, or biopsies. If we can accomplish these lower production procedures during what would have normally been blocked scheduled as consultations, you've killed two birds with one stone. You've completed a new patient appointment with a little bit of extra production, and you haven't used up future block scheduled production time with lower valued procedures. In our office, there are two common situations you're going to see. One, a patient who's previously stated over the phone that they would like same-day treatment, and two, target patients who have not outright stated they want same-day treatment on the phone, but that would be great candidates for it. So, how about the patients who we already know want same-day treatment? In our morning huddle, it's important to identify each patient on the schedule that has the potential for same-day treatment and come up with a strategy to get it done as efficiently as possible so that everything stays on time. In our office, the administrative team has already identified patients who have expressed the desire for same-day treatment when the appointment was scheduled over the phone. When they make the appointment, they label the patient with "wants same-day treatment." This makes it really easy when reviewing the schedule in the morning huddle. When we know these patients will likely move forward with treatment, the room is set up with the intent to do so. How about patients who have not been identified as wanting same-day treatment over the phone? First off, you need to make sure it's a treatment we can actually complete in a single visit. Not all types of treatment can be performed in the same day. For example, osseous surgery would be darn near impossible to pull off in one appointment because the new patient appointment itself requires a lot of data collection, and generally the surgery takes a long time to perform. This could potentially put you hours behind in the schedule, and it's a bad idea. Types of treatment that can be performed in the same day include extractions, implants, immediate implants, crown lengthening, biopsies, and sedation. But there's more to it than just the type of procedure. We need to review the call sheet that the administrative team put together for very specific information that can either increase the speed or make or break same-day treatment. Pain, for example. If the patient's in pain, we can use this to our advantage to motivate the patient to accept same-day treatment. Blood thinners. You all should know which blood thinner drugs are safe and which are not for same-day treatment. Bone density meds. This is generally a no-go for same-day treatment and must be reviewed with the doctor. Antibiotic pre-medication. Let them know that we have this on hand and can easily give them a dose if they plan to go through treatment that day. This should never slow us down. IV sedation. Chances are the patient has already been identified on the phone as someone who's anxious. If not, we need to make sure that they're on an empty stomach before we sedate them, and this means no food for 6 to 8 hours. So let's say we have a target patient with a procedure that can be performed in one day. Initially, the patient should be treated as if they are any other consultation, but everyone on the teams know that they're a target for same-day treatment. Instead of setting this room up for consultation, the room has been tentatively set up for surgery, and this means that the surgical corsettes are in the room, but they're still covered with sterile drapes. We want to be fast, but we don't want the patient to see the surgical equipment and get cold feet. In addition to the surgical cassettes, a basic setup should also be there, just like any other new patient consultation appointment. When the patient is seated, initially there shouldn't be a deliberate discussion of same-day treatment unless the subject was brought up by the patient. If the patient asks, then awesome, we know they're serious about getting this done today. If they have not brought it up, then proceed with a clinical examination like you normally would. While you, the assistant, are seating the patient, you should be gauging their level of anxiety and continuing to monitor their expressions and body language throughout the examination as well. Once the examination has been completed and a treatment plan formed, the doctor needs to walk away. In our office, the doctor is going to take the flow sheet where he puts the treatment plan together up to the treatment presenter and walk her through the treatment plan. Now this is where the magic happens. There are a number of ways to ask about same-day treatment, but this is when you, the assistant, can tactfully move this thing forward. So examples. So, how fast do you want to get this thing done? Or, would this be something you'd like to get done today? If you can tell they're worried at all as well, you can also say, let's just get this done. That way, you don't have to stress or think about it for weeks. When you have this talk, make sure to stay up and close to the patient when you say this, because it may help comfort the patient and increase the level of trust they have in you. They're going to know that you want to help them get it through it. Next, if you know they have a driver there, you can suggest we do IV sedation as well. You know they're nervous, so this is a great way to improve IV case acceptance as well. However, if you can tell that the patient is not nervous, you could say something else like, let's just knock this thing out. It's no big deal. We'll have you in and out of here and on your way to healing, something like that. Remember also to add a level of urgency. This is a great way to motivate patients to completing treatment in the same day. For example, we can do this right now for sure, but if we don't, we're scheduled out 4 or 5 weeks, and we're concerned of what kind of damage may happen in the meantime. Look at your x-ray and see what it's done already. That'll work. How about treatment planning in advance? So the patient says they're interested, but they want to know how much it costs. If the referral form or our call sheet has already identified exactly what they're here for, then it's pretty easy to go ahead and enter the treatment plan into the patient's chart before they're even in the chair. You should all understand how to treatment plan in Dentrix by now, so simply refer to the CDT code lecture in the treatment planning training series for additional information. Oh, and it's also worth noting that we have multi-codes already built in Dentrix as well, which makes treatment planning even that much faster. But if you're new and uncomfortable building a treatment plan on your own, you can always have the treatment presenter from the business admin team come back to your chair and present the treatment for you. However, if you are comfortable, go ahead and print the treatment plan, put it on a clipboard, and review it with the patient. Always remember the selling techniques, the lectures from our treatment coordinator training series. Remember, doctor time is worth a minimum, if not more, of $2,000 per production hour. So, if you have a patient who is resistant to the cost of treatment, you are 100% allowed to discount things to help get the cost down enough so that the patient will say yes. Just make sure not to discount it below that bottom line, which is around $2,000, $2,500 for your doctor, because they're not going to be very profitable. Excuse me. In order to make same-day treatment possible, we have to take our inventory of implants and surgical supplies into consideration. This means we need a deeper inventory than most other offices. It would be terrible to wind up in the middle of an implant surgery and not have the right length implant to get stability. It's critical that the implant coordinator follows the implant ordering guidelines so that we never run out of anything that we need. So, what are some other ways to be efficient with your time if the patient has decided to move forward with same-day treatment? Well, if the patient's going to have IV sedation and you're trained in phlebotomy, you should start the IV before bringing the doctor into the room to start surgery. If the patient is scheduled for PRF, go ahead and move forward with drawing the blood and placing it in the centrifuge. When it comes to PRF, use logic. If the surgery is small, for example, a single tooth extraction with grafting, you should only obtain 1 white tube and 2 red tubes. If the surgery is big, for example, maybe ridge augmentation is involved, get 1 white tube and maybe 4 to 6 red tubes. When it comes to needle sticks, in our office we use the 3-strike rule. If you can't get it after your 3rd try, go get the doctor. And be sure to leave them 1 vein. If the doctor is running behind, try to speed them up. Apply topical anesthetic while you wait for the doctor. Or look for hygienists or other doctors who are free. If they have a free moment, have them come anesthetize the patient. If there are no free doctors, start your clinical note and start putting together your referral letter for the referring doctor. If you've completed all of these steps, see if you can help another team member with something. Once the doctor's in the room, it's time to anesthetize the patient. This is a huge part of what we do. Needle phobia is a major issue with patients. This shit hurts. We have a couple of things we can do to help the patient be more comfortable through this process. First, we can use the dental vibe. We all hate it, but it works. The dental vibe is the ultimate distraction device. It's used at the site of the injection to decrease pain felt upon injection. Second, you, the assistant, should rub the shoulder or hold the hand of the patient while receiving the injection. This little human touch can significantly improve the patient's comfort level during the injection. Speak gently into the patient's ear and say, breathe easily through your nose, slow breaths. Be careful not to overdo this. Sometimes you can take it a little too far. After the injection, the doctor may leave to let the anesthetic soak in. The doctor may use this time to check post-ops or finish some other shorthand task. This is a great opportunity for you to run through post-op instructions. If the patient is sedated, bring the patient's caretaker or driver back and review the post-op instructions with them. Once the post-op instructions are complete, go grab the doctor. Once the doctor has completed the surgery, make sure to take the post-op or post-surgical photographs and radiographs so that you can add them to the referral letter. Once this is complete, make sure to review the postoperative instructions with the patient if they're not sedated, inform them of postoperative videos, and make sure that the business administrative team has texted the video link to this patient's cell phone. Make sure the patient has scheduled their post-op appointment as well. If they haven't scheduled a post-op appointment yet, you can do this while the patient is still in the dental chair. If the patient is sedated, make sure the patient is monitored carefully all the way to the car. What I mean by this specifically is make sure they're in a wheelchair. They should never be given the opportunity to walk. Why? Because if the patient falls on our property, the business could be sued, and then no one of us would have a job. Don't let this happen. Once the patient is seated safely in the car with their driver, you can go back and break down the room. And that's pretty much it. I know it's a lot, but it's really important we nail this. Time is of the essence here, and if we don't use every little detail to our advantage, we will wind up running behind in the schedule. I encourage you to review this lecture as frequently as you need to make sure you understand every little bit of it. All right, we'll see you in the clinic.